See? Okay. Okay, Michelle, thank you.
All right. Can you hear me now? Okay. So I'm gonna talk about a concept of pain care. It's called whole person pain care, and this is a concept that's been very much embraced in the VA. And then when you go to more conventional medicine, you know, they like to use terms like multimodal. But I am a doctor of specialty in integrative medicine, which, you know, originally it was called complementary and alternative. And then the term kind of got switched to integrative so that we could bring it all in together with conventional care so that people didn't have to choose one or the other. So I'm a licensed naturopathic doctor in the state of California, and I work at the University of California, San Diego. So my past experience was that I did a postdoctoral fellowship studying the endocannabinoid system. So this is a whole body system that we're going to talk more about, involved in many things, homeostasis of systems in our body. And it kind of provides a really cool analogy to look at the whole person. So I got invited to the University of California, San Diego through the pain division there, and Dr. Mark Wallace. He and I met serendipitously on the East Coast, and he said, I need someone who can talk to my patients and educate them about how to use cannabis for either opioid tapering or for adjunctive pain control. And so that's pretty much the work I've been doing at UCSD since about 2016. All right. So just to give you an overview of this system called the endocannabinoid system, named after the plant cannabis. It has been described by a researcher, Dr. Vincenzo Di Marzo, as a system to provide that we eat, sleep, relax, protect, and forget. And so if you think about these 5 things, we need all of these things just simply to survive on the planet. And so it's considered a survival-based system. So I'm going to kind of be bringing these different areas up as we go through the slide deck, and using it as a way to illustrate maybe how cannabis is also involved in each of these areas, but we're going to talk about the whole person and pain care. So when we talk about whole person pain care, this fits really good with naturopathic medicine because we really work from a solid base. If you look at the bottom of this pyramid, we always want to start at the very base. Like before we intervene with a drug or even giving you a supplement or anything else, it's what are the obstacles to establishing optimal health for each human being? So often these are simple things just like trying to optimize sleep and nutrition and stress resilience. So those are like the basic things that I start with all patients. And often I want to see first, let's improve your sleep and let's see how much better you get just by doing that before we move kind of up the pyramid to more interventions. And then we also like to stay with low-level intervention first. So just trying to stimulate the body to heal itself using natural substances, natural approaches, supporting and restoring weakened systems, using other therapies for the physical body itself, and waiting until the last thing to go to pharmacology or pharmaceutical medicine or high force type of intervention like surgery. So, not everybody can do this, but sometimes it's good to just kind of back down on the pyramid to see if these things are covered or not. So we know that people who live with chronic pain are experiencing a lower quality of life. and there are increased risk for mental health problems and social isolation. And this multimodal approach to treating all these aspects of the patient may not always be addressed in every healthcare setting. So let's kind of start with a definition of what is pain. Pain is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential damage. So we'll talk more about this because I think we often think about pain as just, coming from the side of injury or damage and that it's localized. But what we're going to talk a lot about is how the brain involvement in this processing can also become a part of the chronic pain experience. So one way that we're going to approach this is to talk about what's called the biopsychosocial model for pain. And this researcher, Gatchell, described this as the unique way that each individual perceives pain, its severity, how it evolves, and the effectiveness of treatment on this constellation of biological, psychological, and social factors. So you can't just treat the pain itself. The whole person has to be treated in order to really address what happens in the long term with pain. So we know that, pain happens usually because there's a nerve being pinched, or you get some kind of injury, or, with dystonia, we don't always fully understand sometimes where pain is coming from. So generally, if you look at this knee in the lower right of the slide, we've got a person here maybe with osteoarthritis, and so there's knee pain. And those sensory nerves send that pain signal up to the brain. Our brain processes these pain signals. And there's also something called the descending pathway, which you don't even see on this slide because it often kind of gets left out of the picture. And it's this descending pathway that we're also going to talk about today. So it's not only the nerves going up to the brain, all of these areas of the brain processing the pain, but also the nerve signals coming back down out of the brain to the periphery. So there are some basic factors that, these are things that individuals can do to modify the pain experience and pain signaling. So what I have on this screen are all things that there is research behind, that we know that if you eliminate certain things or adjust or optimize certain things, that all of these can have small improvements on pain. And so when you add them all together, hopefully you get even a bigger pain benefit. So we know that smoking cigarettes and nicotine is one of those factors. Our nutrition, and we're going to dive a little deeper into that. Alcohol use. So, I have plenty of patients who say that alcohol helps their pain, but in the long term, that alcohol use is actually so detrimental to our biological systems that it's really not a good idea. The role of depression, exercise, and our weight, how we're metabolizing, like our hemoglobin A1C, our glucose levels in our body. And then again, we're going to go back to the brain and talk about how the brain has actually learned pain over time. So let's start first with our biology. What is wrong with my body, and what can I do to take better care of my body? So there's a lot of factors involved in this. We know that we are all coming into the world with predetermined genetics. So we can have genetics that often we may not even know what these are, that may predispose us to having certain things. And then we have some sort of environmental hit that triggers something. I had a patient the other day that has a an immune genetic thing, and she had an event where she got the norovirus and got sick with a gastrointestinal infection, and resulted in her getting a diagnosis of colitis. So, this is how our environment and our genetics can come together. And we can't really change our genetics, but we can change how those genetics are impacted by our environments. Food and sleep, those are things we can modify, that we can improve. Other aspects of our lifestyle, such as our activities, our social networks, effects of other drugs that we may be on, and interestingly, also our social history, but we'll go more into that on a different section. So if we just simply think about our body, I think the best analogy for this is really thinking of ourselves as a garden. And I am a very avid gardener. I have a degree in agriculture. So studied soil science and soil pathology and plant pathology and all of that. And the message is so similar to what we learned in naturopathic medicine, that you have to start with the foundations and build up. So if we don't have healthy soil, we're not going to grow healthy vegetables to eat. Those vegetables are going to transmit all the minerals in the soil to us. And if the minerals are not in the soil, we're not going to get the minerals. So likewise, we have to think of our body as a terrain, and we want to optimize that terrain so that we can continue to water that, or provide nutrients so that we can build and grow into a healthy plant. So I really love that analogy. If sometimes medicine is attacking the weeds in our garden, I think of chemotherapy with that. You could think of pain as a weed and pain medication, but there's still this terrain and this underlying stuff of our biology that can often be addressed to improve our overall health. So let's start with that. Let's start with eating. We have to have nutrition. We need basic calories to have energy. We need all those things like protein and carbohydrates. And we need a good appetite. We need good gastrointestinal function. So all of these things have to come together for us to be even able to access the nutrition. So starting at the basic level, food is medicine. All of our plants contain not only those things like glucose, other sugars, proteins, what's the other one? Fats, that's what I was trying to think of. We have all of those nutrients, but then the plant world contains all of these other compounds called secondary plant metabolites that aren't directly feeding us, but we have a biological connection with them because the compounds in plants interact with our biology. So food and herbs and spices, all of these things that we take into our body are part of our environment shaping us. So let's talk about this nutrition for chronic pain a little bit more. And so you can see this is kind of a busy slide, but if you start up in the upper left part, you can see fruits and vegetables, whole grains, dairy products, healthy fats, lean meats, all of the things that we consider like a kind of a Mediterranean style diet. And if we're not getting these, if we're not getting these basic nutrients, plus all of the colors that we get from plants and healthy fats, we can be actually boosting inflammation in our bodies. Secondly, we've got this connection with our gut, where we have a whole world of microbes living in our gastrointestinal system, and they are making things for us that we need. And so we need to feed our microbiome. And then we've got the whole concept of glucose metabolism. And, this becomes an issue as we get older, or if we have a familial predisposition for diabetes or metabolic disease, that this glucose control can be a problem. And too much glucose just circulating around, it is another way that just feeds oxidative stress and inflammation in the body. And then we talk about lipid metabolism. We all come with a predisposition from our genetics of what's our cholesterol levels going to be, how good is our HDL, how bad is our LDL. And these things all combined can lead us to being overweight or even having to deal with obesity. And every one of these things can be adjusted toward impacting chronic pain. So let's just spend a minute on glucose. I tell patients a lot, we are fully grown adults now. We do not need a lot of glucose to fuel us anymore. We needed that when we were growing and our body needed a lot of energy. So as we get older, pastas, breads, anything that's not a whole grain, or even sometimes too much whole grains, is really just going to boost our glucose level. And, we have putting on weight around our midsection or wherever we put it on. And carbohydrate is just going to contribute to that. And that, this is, again, it just becomes a cycle of getting overweight, and then that affecting how we are metabolizing lipids and leading to hypertension. So you're going to see a lot of these kind of cycles that go on, but you can really adjust a lot of this by addressing that carbohydrate intake. And then I just wanted to talk a bit about the microbiome, because it is so important and something that's so often overlooked. This connection we have with this whole world that lives within us, and they actually outnumber us. The amount of DNA in our microbiome outnumbers our own DNA. And we kind of come into the world with a preset microbiome, but this microbiome also gets affected by what we're eating and our environment. So this microbiome can shift over time based on our age, our genetics, what's going on in our GI system, how we're digesting, alcohol's impact on this, other medications that can impact our microbiome, antibiotics that don't care which bug they're killing. You probably maybe have all had an experience of taking an antibiotic and getting an upset stomach or diarrhea, because we need to come back in and rebuild the microbiome. And then we've got what we call xenobiotics, things in the environment that can be affecting our microbiome along with our diet. And something people don't think about a lot, but most artificial sweeteners can be really impacting what bugs are surviving or thriving in our GI system. So why is this gut bug system so important? So this wheel that you see is just kind of going through all the different reasons. So if we start with the intestines, and we have these enterocyte cells, and they're supposed to be very tightly joined together. If you have inflammation in your gut, we can get leaky gut. So this means things are getting in through those cells that should not be getting in. And this can lead to allergic reactions, inflammation in the gut, disruption of our immune system. So that's one place, just the intestines themselves. We've got the stomach. Our stomach, we make gastric acid. Our stomach has to move things through. And when everything's optimally functioning, it's all well and good. But we know when we get older, our amount of gastric acid can go down, and then we can't break down foods as well. So paying attention to how our digestion is working. Food comes through and we extract the fats out of there, and all of our nutrients go through the liver before they reach the rest of the body Fats kind of get processed a little bit differently, but they do get packaged in the liver. So we need to have really good liver function. And then we're storing fat in our adipose tissue. And, we may have a problem with either not storing enough fat or we're storing too much fat. And, this all can get dysregulated with age, and we're struggling one direction or another. And then we get to the brain, and, these gut bugs actually make vitamins for us and neurotransmitters and GLP-1 and, all kinds of things that we need. And affecting our pancreas, our insulin, which helps us get glucose into our cells. And that's what our cells need for energy, and our brain needs glucose. So what can you do to help the microbiome? And the answer is fiber, fiber, and fiber. And it is recommended that you get 25 to 30 grams of fiber every single day. And so this isn't just for, people often think of fiber as, oh, I need that for constipation. That's one reason. But also it helps us clear cholesterol. And then the other thing, that the gut bugs are taking this fiber and they ferment it. It's their food. And the metabolites of that are our short chain fatty acids. And these compounds are supporting our immune function, our bone function, our central nervous system function, even acting as anti-cancer compounds. So this diversity of fiber is going to ensure we have a diverse microbiome to keep all of these things we're talking about running smoothly and having the least likelihood of contributing to inflammation in our body. All right, so that's part of biology. And then the other really important part of biology that can get overlooked or just swept under the rug is our sleep, and what is the effects of insomnia, sleep apnea, or being off of a circadian rhythm. What are the effects of that on our health, and particularly chronic pain? Well, we know that pain often disrupts sleep. I mean, it varies, of course. Some people go to sleep and they say, oh, that's the only time I don't have pain. Other people say, oh yeah, my pain starts ramping up in the evening, and by the time I go to bed, I can't even get to sleep. So we have this cycle of pain disrupting our sleep. And if sleep is disrupted, pain is actually worse the next day. So if we can treat pain at night and treat sleep, pain improves. So one aspect of this that I'm often working with people on, especially if there is a disruption of the circadian rhythm, and what does that mean? I had a patient the other day that she has a lot of health issues, and she's young. She's about 34. And I hadn't seen her for a few years, and she came back in and she has some autoimmune disease and just suffers with severe chronic pain. And I find out that she does not go to bed until 3 a.m. And so if you look at this graph, this is a graph of what our melatonin production related to sleep is doing. So you can see the pink dotted line, that's like taking a blood sample of the melatonin across time. And the other one is saliva. And you can see the dark gray line is when it's dark. So you see melatonin racing up to a really high level during the nighttime. What is it? Why is this? I mean, a lot of us know melatonin is for sleep, right? Well, we also know as we age, melatonin levels go down. And in certain neurological disorders, there can be a disruption of melatonin production. So I like to use melatonin for helping people get into sleep. But interestingly, if you look at the time when this melatonin is peaking, you can see it's about 3 a.m. So sometimes taking melatonin at bedtime can get us into sleep, but we metabolize it very, very rapidly. So this is when If somebody's waking consistently between 2 and 4 a.m., it can mean that you're not getting that good melatonin peak anymore. And so this is a time when sustained release melatonin that's going to get delivered over time and not metabolized so quickly can be helpful in sustaining sleep. And the other importance of melatonin is that it is a really powerful antioxidant. It also is triggering in our genetics something called clock genes. And these clock genes, I like to think of them as the housekeepers or the cleanup crew that comes into the factory at the end of the day and sweeps everything up and cleans everything out. So for the next day, the factory can run. So if those clock genes are not getting turned on, if every cell in our body is not getting swept out, this all leads to more inflammation in the body. So related to that, I just wanted to talk about cannabis and the role of cannabis for sleep. And we don't have a lot of good data. It's been so difficult to study cannabis, but I think one of the main takeaways here is often people hear that cannabis is bad for sleep, that it's as bad as alcohol. And this came from some very old data from when THC first got isolated back in the 1970s, and there were some sleep studies. And I've looked at the doses. The doses of THC were 50 milligrams, 75 milligrams, and 150 milligrams. And what they showed from these doses was that it interrupted our REM sleep, or our rapid eye movement sleep, and that's not a good thing to be happening. And then you fast forward to more current times, and there have been only a couple of studies again on, formal prospective trials where they take people and administer THC. And so in this group of people, they wanted to look at sleep apnea, which, that's something that needs to be treated, because if you have apnea, it's disrupting a lot of these homeostatic processes in the body. And so they used a pill form called dronabinol, which is on the market as Marinol. And this is one of the few drugs we have that we can use to formally study cannabis. And so what this graph is demonstrating, if you look at the graph on the left where it says 0 milligrams per day of dronabinol, so we have this black wiggly line, which is illustrating our ultradian rhythm, or how we're supposed to go down into deep restorative sleep. We come back up and we go in and out of that across the night. And they're just showing these gray lines of how that rhythm didn't particularly look that great. You can see the gray lines are not really matching up with the black lines. And then this representative graph on the left side is showing what they considered to be a strengthening of the ultradian rhythm. And so this is a good thing. We want that good rhythm at night to get that deep restorative sleep. And so using sometimes melatonin and specifically THC at bedtime can, and we see this clinically, really, really improve sleep for people, and also the THC treating pain at night. There is not any of this kind of data for CBD at all. CBD has not been shown to alter anything in this ultradian rhythm as far as we know to this point. And then sort of the last topic before we move on is to talk about exercise. And, when we have chronic pain, just getting older, aches and pains, we start to have to adapt what we're doing for our bodies. And, it's hard sometimes to let go of, well, I should be doing this, or I need to be doing more of that. But I think it's really important, to be working with your own body and adapt any kind of movement. The important thing is just to move, because as we get older, particularly our connective tissue, and you may have experienced this just in a short period of time. If you don't move, you just feel stiff. So we have to think about nourishing this connective tissue. And so there are nutrients that can do this for us, but also hydration is an important part of that. Getting electrolytes, or those minerals we need. and also moving our bodies and stretching. There's just too much evidence that one of the best things for pain is actually exercising and moving. So sometimes, we need help with that from a physical therapist or other exercise specialists who can show us how to properly move so that we don't injure ourselves. So always moving back into activity slowly and carefully. So yeah, here's just some of the data on that, this exercise and how the title of this is exercise induced hypoalgesia. So hypoalgesia means turning down the volume on pain. So in pain-free and chronic pain populations, we see that exercise is boosting our sympathetic nervous system. It's boosting our endocannabinoids. It's boosting our serotonin, our opioids, all of those feel-good compounds. It actually improves our immune function. It stimulates the immune system. And it can have positive benefits on our brain and our outlook and our health surrounding our bodies. And so altogether, we're calling this exercise-induced hypoalgesia. So that hypoalgesia, hypo meaning less, algesia meaning pain. We want less pain, and this is where movement has demonstrated specific ways that movement and exercise is doing this. Okay, so the next part we're going to talk about is our psyche. And what is the psyche? Great question. That psyche is that part of us that we can't see. Does it reside in our brain? I mean, our psyche is everything about us that's not our flesh and blood. It's all of who we are that comes from all of our experience. So we know that psychological factors are associated with pain becoming chronic in 83% of cases. So don't get offended or confused. I'm not saying, I think people have gotten offended in the past by saying we're imagining pain, or, if you say pain is in the brain, but no, it's in my elbow. So we're just going to kind of like delve more into this pain processing. So we have awareness of our feelings. Do we accept those feelings? Are we being compassionate toward our feelings? How do we cope with everything we're feeling? Because these feelings can either turn up the volume or turn down the volume on pain. And especially pain over time can lead to a feeling of helplessness and sort of being paralyzed or not wanting to move, not wanting to get out. And this is all part of a stressful experience. So I'm going to talk more about stress. And one thing about stress that we're going to talk about is something called toxic stress. And I have another slide on that. So we can look at specific types of what's called toxic stress. And this is kind of different from just our daily stress that we encounter, having to drive in traffic or get somewhere on time or whatever our daily stress is. So we know that long-term stress leads to prolonged elevation of adrenaline and cortisol. But then over time, our system starts to down-regulate those things. And this is where we can become very maladaptive in terms of a stress response. When cortisol gets turned down, this is actually pro-inflammatory in our body, and over time leads to changes in both brain structure and function. So again, we're just talking about the whole person and how all of these things are combining together. So what is toxic stress? Let's talk about this a bit, because a lot of people are more impacted by this than they often realize. So this comes from work on adverse childhood experiences. And so these can be generational things. Many of us may want to minimize whether we had an adverse experience in childhood, but in this first graph, this is listing like what we call the Big 10. And so this is what the adverse childhood experience survey or questionnaire is built on. Did you experience any kind of abuse as a child? Were you living in an abusive environment in any way? Was there neglect? And that neglect can come from other challenges going on in the family system, like divorce, a parent who's mentally ill, other domestic violence or substance use. And it's just amazing how many of us may have actually experienced these things in our childhood and not really thought about long-term impacts. So this is prolonged, going on throughout childhood. And we know that over time, this affects our physical health. In the moment, it's like an increased heart rate, our blood pressure go up. When we feel stressed, we're breathing faster. We have this cortisol and epinephrine release. And this downregulates the endocannabinoid system, or that homeostatic system. So, eventually it leads to turning off the stress response. And this affects our development as children. And what we really need is to build back our resilience to stress, because it really got destroyed during these childhood experiences. But even beyond these 10 adverse childhood experiences that are the 10 we usually score for, there's a lot of other things that people may have experienced that don't get accounted for. So living in poverty, experiencing racism, other types of violence, separation from family members, generational, intergenerational, cultural trauma, the death of someone close to you. So it's just good to think about yourself and, hey, what did I experience here? And how could that have experienced how I can respond to stress today? Because this stress resilience is so important and impacts pain. So these are the areas of the brain. We've got the hypothalamus, which is like a master control system. It signals to our pituitary gland. Our pituitary gland sends a signal down to our adrenal glands. Our adrenal glands then secrete this adrenaline and cortisol. And this is a natural process. This is to help us respond to stress. But if you're not getting that response, or you're getting too much of it, this is where stress resilience can break down. And when it does break down, again, it's a pro-inflammatory process. It leads to brain remodeling. And this brain remodeling is part of how we can be improperly processing pain signals. So here's another cycle. We've got this stress or trauma. It puts us into that sympathetic hyperdrive so that we can respond to the stress. But if that goes on over time, it leads to neuroinflammation. That neuroinflammation leads to brain remodeling, which turns up the volume on pain and contributes to anxiety, depression, sleep disturbance, which is more stress. And so you can see how the cycle just goes on and on. And so what we want to do is find ways to break the cycle. So improving stress resilience is sort of a foundational place to do this. So how do you improve stress resilience? Well, it takes time, it takes effort, it takes practice. So, if you're not very stress resilient, you may be experiencing anxiety, panic attacks, things being traumatic when maybe they shouldn't really be traumatic. This is all stress. It leads to high blood pressure. It can affect brain function where you can't really focus on anything, or you can't get things done because your brain just can't be there for you. So this is one role for cannabis. There's kind of paradoxical reactions in terms of cannabis and anxiety, because a lot of times I'm asking patients, what is your, did you ever use cannabis? Oh yeah, it was horrible. It made me horribly anxious. Well, if you go to the literature, and this is like a bunch of surveys, at the bottom, it's telling who did the survey, what year it was done. At the top of the bars is how many people was in each survey. But you can see about 50% of responders said, I use cannabis because it helps my anxiety. And then in addition to that, several of these surveys asked people, well, do you substitute cannabis for anti-anxiety medication? And you can see again that maybe 25% or so say they're using cannabis to substitute for an anxiety or an anti-anxiety medication. So this can be tricky because it all has to do with dose. So this is what we call a biphasic effect, that at a low dose, cannabis or THC can be a very calming experience, but with the high potency of products out there, that it could also increase anxiety. And this is very individual to people, but mostly related to the dose of THC that people are getting. So we know that there's something going on called pain processing, that fear turns up the pain volume, fear or stress, they're kind of similar. And so there's just another feedback loop. You feel pain, pain is perceived as a threat. This induces that stress response. It leads to tension, which just increases the pain. So we want to find out how can we break this cycle again? We know that breaking or taking a pain relieving drug can break the cycle. We know that taking an anti-anxiety drug can break the cycle. We know that working on our bodily tension can break the cycle. So we're talking about, it's a lot of work, but it can be very much worth the effort. So this pain processing, this is going on in the brain. And so there's been all this research around these, what we call brain networks. So, we know that networks are these individual pieces that are all talking to each other. And so this is just one diagram of some certain networks. So the salience network is something that's taking in things from our environment or even reading our pain signals. And then in the brain, our brain has to decide what to do with these signals. And so then this goes to an area called the default mode. The default mode is where we should be relaxed. We should be daydreaming and just not really thinking about a lot. And kind of opposite of that is our executive network. And that's something that we're engaging in, like if we're following a recipe, cooking from a cookbook, you're following directions and you're doing specific things. And so these are all working together and part of pain processing. And all areas of our brain are plastic. We know that we can reshape these pain pathways and these networks and these communications. They just become like ruts in a road. So if you've had pain over time, it's like a rut in the brain, and your brain just wants to keep going that way. And new evidence is showing that even once that the pain signal may not even be there anymore, the brain can still be in this rut thinking that pain is there. So pain actually is in our brain. So yeah, we want to address how can we influence this incoming pain signal and get to a default mode that's that relaxation one. And one way to do this is to activate our executive network. So I had a patient one time, and he had this horrible neuropathic pain, but as long as he was playing a video game, he had no pain whatsoever. And as soon as he quit playing the video game, his pain would come back. So this is an example of activating that executive network and how it kind of like cuts through the pain signaling. So this is something called flow state. And there's so many activities you can get involved in to induce that executive network, kind of to take your mind off of pain. So anything that's really actively engaging the body and the brain together is probably optimal. And, it doesn't have to be a physical activity. It could be painting by number or doing some other art activity, anything that's kind of taking your mind off of the pain. And this helps to break down those ruts in the brain that could be contributing to pain signaling. So a strong task engagement is part of breaking that cycle. And another part that I think is so simple and so overlooked is what one of my yoga teachers called the breath, the magic breath. And, just really getting into a breath practice, using your diaphragm to really take in a long breath. So there's different ways to do that. Here's one. You breathe in for 4 seconds. You hold for 4 seconds. You breathe out for 4 seconds. You hold for 4 seconds again. And that's really, if you do that, that's one breath in 16 seconds. And typically we're breathing 16 times a minute. So we're talking about really slowing the breathing down. And this, of course, is really important in the moment when you feel stressed. But even doing this when you don't feel stressed, it's a way of training yourself to do it. Practice of mindfulness. Getting specific training in meditative mindfulness can be helpful for a lot of people. Listening to music, or even better, singing along with music. Massage, getting that distraction from some nice physical sensation. Getting into water. There's great evidence for cold plunges, boosting our cortisol and our dopamine and making us feel better. And that cold water is anti-inflammatory. So these are just a few ideas, but you can come up with your own. There are things that may work for you that don't work for everybody. But what we really want to stop is that salience network going to a default mode that is just ruminating. So this is shown to happen in people with depression. And if you've ever been depressed, which I have, you can probably relate. Your mind just wants to go and do a loop on negative things that have happened to you. Why does this happen? I mean, part of it could be our personality. Part of it could be conditioning from a previous situation. But it can lead to the brain really catastrophizing and just thinking the worst. And these are things that can be changed by us with hard work. We can learn new mental coping skills. So what are some causes of why you may be ruminating? Well, people with some level of OCD, and it just doesn't even have to be the worst level where people are hand washing 45 times a day. But I have a little bit of OCD, and it could just be reorganizing things or needing things to be really clean. Depression, too much stress, traumatic events, phobias, anxiety, all of these can reinforce that rumination. So if this is you, this is something that you want to work on, because this is only turning up the volume on pain signaling. So where do we want our mental energy to be? The best way to start each day is with a grateful heart. So there is an amazing video on gratitude that if you've never seen, I can send it to Martha, because there are times when I have watched this gratitude video on a daily basis. And so, yeah, it's like physical training. It's like brain training. You have to get up every day and have a gratitude journal and write down 10 things you're grateful for. And go back to that every time you catch your brain going back into the negative loop. But evidence shows that even once per day, having a little gratitude practice leads to more happiness, better resilience, and better ability to reframe things in your own mind. All right, let's talk about our social relationships, because this has an impact on our pain. So of course, most importantly, those people closest to us, our family, the people that we live with, our close relationships, are those relationships supportive? If not, how do you get to a place where they are? That's, that's very foundational, that the people closest to you, you feel like they are a support for what you're going through. And then kind of the next level out would be friends or colleagues, people that you work with, other people that you interact with in the community, and cultivating very healthy relationships. And we know that having these good quality social experiences contributes to turning down the volume on pain. So sometimes we have to go cultivate new relationships. People get a diagnosis, their old friends don't want to be around them anymore, but guess what? You can always make new friends. It can take effort, and that can be a form of grief, if you lose some of your old friends. But there's always new ones out there. And then finally, a therapeutic relationship. That can be very helpful with helping to reframe everything, and cognitive behavior therapy. There's something called pain reprocessing therapy, and these are all other therapeutic ways to help retrain the brain around pain signaling. So yeah, living with chronic pain can lead to this loss of social connections, losing previous roles that we may have had in our community or in our lives, conflicts within these close personal relationships, which can lead to isolation, loneliness, and depression, which what's going to happen? Turns up the volume on pain. So another area to be very proactive, because building social ties reduces pain and improves quality of life. Even just going out and viewing art, you're out in the community, you're around other people, and the interaction of just looking at art has been shown to be antidepressant and anti-pain. And then kind of finally, somatic experiences. Often pain can cause us to really lose touch with our bodies and what our bodies need, because we're just like focused on the pain. So becoming mindful of our body again. Movement is one way to get into that, to kind of reclaim our body and to bring our mind and body and yoke them again. This is what yoga means, the yoking of mind and body. It helps to open our senses, to bring us into deeper insight, and hopefully bring us into healing. And just to tap into these bodily sensations increases something called interoception, our ability to read our body's signals and to read them in a healthy way. So this is something that trauma and excessive stress can really cause a block in this interoceptive awareness. All right, we're going to move on to talk a little bit more about inflammation, because this is so important. Because we know what happens in chronic pain, and I was talking about maybe the source of pain, everything's healed, but what has happened in the meantime is something called central sensitization. And so these are complex interactions going on between the nervous immune system that all turn up the volume on pain, leading to what we call hypersensitivity, where pain feels worse than it actually should. So this is kind of a complex diagram, but this is part of what I studied in my postdoctoral fellowship. So the first thing that you see are all, you can see the nerves, right? The purple one is a nerve, and then the other cells around it are the supporting cells for the nerve itself. And one cell that we studied in my postdoctoral fellowship is called the microglia, which is it's an immune cell in the brain. And anytime there is inflammation that affects the brain, these microglia get activated, And when they're activated, they're typically pro-inflammatory, but they're there in response to a virus or other signals that promote inflammation. In this picture, you can see the COVID virus, because they found that people who died of COVID, they saw this inflammation really clearly in the brain. But this is also going on in complex pain. So these microglia get activated, and this is just where I wanted to bring in a potential role for cannabis and other anti-inflammatory herbs, but especially the cannabis, where it's binding to these cannabinoid receptors that are on the microglia, is another means of turning down inflammation. It helps shift the microglia to a different expression where they're now actually in a healing mode. So that's what you see to the furthest right on this diagram, that we're going from an M1 to an M2 type, where we're going into that healing of the brain. And we have human data on this in people with HIV, that it's actually turning down the volume. Cannabis use is turning down the volume on inflammation in the brain. So treating that brain inflammation is an important part of treating pain, because stress is amplifying pain by increasing inflammation. So at the very basic level, becoming stress resilience, reducing our stress, and not allowing stress to be exacerbating our pain. So we can get tons of anti-inflammatories from our foods and from herbs. So here's just a sprinkling. Ginger is a really common one. That's something you can add to your diet. Curcumin, the active compound in turmeric, which is a spice. So we can just be using spices in our diet. We've got other herbs that aren't normally in our diet, such as one called boswellia. We've got the cannabinoid compounds. And then all of the healthy compounds, colors, healthy fats in our foods. These are all means of getting to anti-inflammatories in our diet. So here's a smattering of a bunch of spices. And so I just say, spice it up. Use a different spice every day. You can have, Thai food one day and Indian food another day, and some black pepper and some cinnamon, and as much spice as you can throw at your body is thought to be a really good thing for us. And then we've got other supplements, nutritional supplements, other botanicals. We know there's roles for vitamin D, B12, methylfolate, alpha lipoic acid, glutathione, and then I already talked about cannabis, turmeric, boswellia. And I use all these kind of individualized for patients based on everyone's unique presentation and what might be needed. And then this last area of the endocannabinoid system is forget. I kind of throw pain into this forget piece, because I feel like we've already seen, our body can forget to quit processing pain. And so even when the signal has gone away, we maybe still be having pain. But we also think of forgetting as, we get older and we're forgetting words. We can't find the word we want, or even memory loss. But there's also aversive memories that come from past trauma. And so overall, our cognitive well-being. So again, I'm going to kind of talk about pain here in terms of forgetting. So this was a survey that I was a part of, that we just asked people about how they were using cannabis. And in this portion of it, we said, are you using cannabis to substitute for other drugs? And so you can see that top bar, the number one thing people were substituting was for narcotics and opioid drugs. And then number two was those anti-anxiety drugs. And then we have number three, antidepressants. And number four, anti-inflammatories, NSAIDs and non-opioid analgesics. So this anti-anxiety, antidepressant effects are probably two of the most understudied things about cannabis, although people report these things. But you can see 46% of people were saying they were substituting cannabis for other drugs. Let's see, I'm just gonna move on. So we did a chart review of people that were using cannabis specifically to get rid of their opioids. So this is a smattering of people. You can see all mostly of older age. You can see the different reasons. They had failed back surgery, they had chronic low back pain, spinal stenosis, spondylosis, and then this MME is their morphine milligram equivalent. And some were very high, others were lower, but you can see that after 4 to 8 weeks of using cannabis, they significantly both reduced the amount of opioid they were using and reduced their pain scores. So we looked at this over a larger group of people, and that it didn't pan out as well, just because a chart review is not a great way to do this, but we definitely saw a trend for people with chronic pain who were using cannabis, and they got specific instruction, and it was from me in this case, about how to use the cannabis, that they improved how much opioid they were using. So there's a lot of studies out there. Again, we can't study cannabis very well. In this instance, they looked at 91 studies and basically found across these studies there was about a 30% improvement in pain by using cannabis. And this is comparable to other drugs out there. We expect about 30% of people to respond to most drugs. They did say, based on this meta-analysis, that cannabis was often unlikely to be used all by itself. So it can be an adjunctive for pain control. And their conclusion was that multidisciplinary care with physical and psychological therapy is better than medication alone. So again, support for this whole person concept of treating pain. And then just quickly, I wanted to show you this study, which was with one of our doctors at UCSD, Nathaniel Schuster, and he is a migraine specialist. He's a neurologist. And we did a study where we had 94 people. They treated 234 headaches, and they used 4 different kinds of cannabis: a placebo cannabis, 11% CBD, 6% THC, or a combination of CBD with THC. And so what you can see from this graph is that at 2 hours, the cannabis with the THC was significantly better than placebo or CBD cannabis. So there's not good data saying that CBD is an analgesic, unfortunately. It may be a part of the cannabis therapy, or it could be part of an anti-inflammatory piece of the cannabis, but as an analgesic by itself, it does not work well. So you can see that we saw pain freedom and freedom from other neurological symptoms that people have with migraine. It came best from this mix of THC and CBD together. So in this case, people were inhaling cannabis because that's a very fast effect. All right, so let's just talk really quickly about, what are some pitfalls for you as a patient if you're just going to go out there and try to get cannabis? All right, so the first one is on this label. This is off of a package of cannabis. This says to take the cannabis every 2 hours. This is an oral liquid. So this can be a huge problem because it takes a while for oral cannabis to get into the body. And often it's not even reaching a peak in the bloodstream until about 2 hours. And so if you follow directions on a package like this, this is a way that an overdose or getting too much THC and becoming uncomfortable can happen. So this is why I think getting advice from somebody who's skilled in using cannabis about how to use it is really important, because this can be a pitfall. Another one is you may go in and somebody just sells you CBD. And really, for most people, spending money on CBD for pain doesn't turn out to be a great analgesic or really, given that pain benefit that you want. But this misinformation about CBD for pain is out there, and you're just going to keep encountering it. Yeah, here's a great one. This was a patient with a lot of pain, and this is the actual sticky note that she got from someone in a dispensary who called herself Dr. Beth. She was not a medical doctor. She had a PhD, and she told her to take a vape pen and to puff on it every 10 minutes. Well, for how long? This woman did it for 2 hours, and you'll never guess where she wound up, but it was in the emergency room because she had basically overdosed on THC at that point. So I just say no to vape pens. Vape pens are extremely potent. They are more THC than probably anybody needs, whether for medical or even recreational use. It's not the plant, very concentrated, harmful to the airway, easy, but not what you want to use as a medicine. And then there's also conflicts of interest of the salespeople when you walk into a dispensary. So they get their information from the manufacturers. And unlike pharmaceuticals, there are not rules. And it could be, hey, we've got a special on this product, and you're going to get some money if you sell a lot of this product. And so this could be a conflict of interest going on where they're just trying to sell you something because it's actually going to benefit them. So this THC potency, more is not better. We've got the whole plant. There is sometimes the potential to get this whole plant with a very low THC percentage. You're almost never going to find that in a vape pen. And so to illustrate this is a study that Dr. Wallace did, and you can see this U-shaped curve. And what this curve is showing us is if you looked at the left side of the graph, people were having a level of pain that was at about 5. And as the THC level went up in the bloodstream, their pain level came down to a 3. But as that THC level went up in the bloodstream, they actually lost the pain benefit. So more is not better. This was vaporized cannabis that was a 6% THC content. I went in a dispensary today, and I'm in Taos, New Mexico. There was nothing in there less than 25% THC. So we don't need that recreational potency for the potential pain benefit. And then this is a graph from some data that I published, just showing what happens to the THC content of flower compared to these extracts. So 20% in the flower went to 70 and 80% THC content in these concentrates, and this is what is in a vape pen. So real briefly, what are risks of using cannabis? Well, if you have pre-existing dizziness or balance issues, there is a risk that you could exacerbate this with the cannabis. Dizziness is probably the #1 thing that's been reported by older people. In my experience, I don't see it a lot. Again, it depends on dose. Do you have pre-existing dizziness or not? There are certain cardiovascular effects, especially if you're new to cannabis. It can have effects on our cognition. We know that it alters our perception. It can have acute effects on our short-term memory or our executive function. It can make some people drowsy, or depending on the dose, even some disorientation. Should I inhale or not? Am I going to get addicted? Are there interactions with other drugs? How should I use it? What product should I buy? So these are all the questions I come up against, and I'm not going to answer all those right here because I'm assuming some of you may have questions. But I thought this is a funny cartoon. These two old guys sitting on the couch saying, "Remind me, is this medicinal or recreational weed?" Because sometimes it's kind of a blurry line, you use it medicinally, but it also can become a replacement for alcohol or just help you relax and feel calm in the evenings. So that's really the end of what I was going to share. Thank you so much for listening to me talk for an hour. This is actually an image I took here in Taos, New Mexico, which is just a magical place for me. And so we got all these empty chairs just sitting stacked around, and maybe these chairs can represent your questions. And so I'm happy to take any questions from you and try to answer them to the best of my ability.